My project on aging in place versus in nursing homes. So, to start off, what does it mean to age in place? Aging in place means remaining living in the community with some level of independence rather than in residential care. Aging in place allows older people to maintain independence and autonomy, have connections to social support such as friends and family, remain in their homes as long as possible, and avoid the costs of institutional care. Here is a short video about aging in place and how older adults can stay living in their homes.
Ask most seniors, and they'll probably say that they want to grow old in their own home.
So many homes and apartments are not designed for disabilities that can come with aging. Roxana Severi shows us how people can get ready.
At age 77, Beverly Bennett says she's starting to struggle on the stairs at her New Jersey home.
I want to grow older here, but I want to keep my independence.
We have a ramp coming up from the driveway.
So she hired contractor Ernie McNeil to help her make her house safer, something he says adults of all ages need to consider.
We all put things off. Important things like this need to be addressed immediately.
Older people have the highest rate of home ownership in the country, according to the Joint Center for Housing Studies at Harvard.
For some,
Managing Director Chris Herbert says many homes are poorly equipped for disabilities later in life.
you need three things. No steps to get into the house, no steps to go up and down when you're in the house, and hallways that are wide enough to be able to navigate a wheelchair or a walker. And right now, only 4% of homes have all three of those features.
Modifications like widening a doorway or installing a chairlift can be costly.
It's good to have a railing on both sides.
But McNeil says smaller changes, like adding an extra rail along Beverly's stairwell, are more affordable.
This would probably be about $400.
The grab bars he's installing in her shower cost $250.
And that would help her prevent her from falling out.
Absolutely.
He also suggests removing throw rugs, which can be a tripping hazard.
It's the worst thing to have in your bathroom.
McNeil says many clients delay getting help because they don't want to admit they need it. Beverly says she's just being realistic.
Look, we're all going to grow old. You can't change that.
She hopes investing now will give her peace of mind for years to come.
I feel safer already.
Roxana Severi, CBS News, Little Falls, New Jersey.
More than 3,000 contractors in the U.S. are trained to modify homes to help people live there safely as they age. You can find one through the National Association of Home Builders, and you actually see a lot of new homes being built with this in mind,
Yeah, the one-story floor plan is one of the most popular floor plans now.
So this video explains that many seniors want to live at home and there are ways they can make their home safer for them to do so. According to data from the AARP, 90% of people plan to age in their homes. However, there are financial, social, and physical consequences that will have to be addressed. There are many benefits to aging in place, such as it can prevent social isolation by allowing older people to stay involved in their communities, which has been found to have health benefits. Civic engagement and volunteering can reduce mortality, increase physical function, muscular strength, and levels of self-rated health, reduce symptoms of depression and pain, and increase life expectancy. An evaluation of Missouri's AIP program showed that participants had better outcomes in the areas of cognition, depression, activities of daily living, and incontinence than those in nursing home care. This finding led researchers to suggest that maintaining independence in one's homes contributes to more positive outcomes. These improved health outcomes can, in turn, lead to cost savings. When might a nursing home be a good idea? Many people living in independent housing have chronic conditions and or functional limitations that put them at risk for falls, increased emergency department use, preventable hospital stays, and nursing home placement. Families and service coordinators face these concerns as they attempt to help elderly residents remain in their apartments and communities. Some ways to recognize if it is time for more assistance for an elderly person are lack of personal hygiene, falls, wounds, unpaid bills, clutter piling up, yard or house needs maintenance, expired groceries, forgetting to take medication, trouble standing up, unsteadiness, loss of interest, and difficulty accomplishing daily tasks. Living alone can come with age-related challenges. Some older adults need to follow a special diet. Are they prepared and equipped to purchase and make food? If they fall, do they have a way to contact someone or emergency services? If they can't drive, will they be lonely and bored at home every day? There are ways to deal with these issues, such as food delivery programs, voice-activated devices, and car services, but these all cost money. Aging at home can place a burden on family and caregivers. 90% of aging-in-place adults rely on help from family, friends, and volunteers. Elderly people living at home creates more work for their family and caregivers. Family members and caregivers often visit daily or multiple times per week to care for an elderly person. They prepare meals, do chores, pick up medications, take the person to appointments, shop, handle financial obligations, and be a companion for the person. Many family members say the person they are taking care of would not be able to live independently without their support. Family members providing care for their loved ones can cause tension. Some family members do not want to tell their elderly family member what to do or how to act. Also, family members may lose patience easily. A survey asked family members how often they access services from the community to help their elderly family member. 61% said rarely or never. Among the people that said rarely or never, the top reasons why they do not access outside services were: I can take care of my family member's needs on my own, which was 48%. My family member won't let anyone other than me assist them, which was 33%. We can't afford to purchase services, which was 24%. And I'm not aware of available services, which was also 24%. In many cases, family caregivers and services coordinators are not regularly communicating with each other. As a result, they are not sharing their respective knowledge and resources and may not be minimizing burdens on themselves or maximizing the success they could have if they worked more cooperatively. There are many features that make up an aging-in-place friendly house, such as low-maintenance exterior and landscape, main living on a single floor, so no steps, good lighting and bathroom grab bars, 5x5 turn space with an ample hall width, lever handles for doors and faucets. Also, occupational therapists and aging-in-place specialists can come in and give a home assessment and suggest changes that should be made to make the house safer for the elderly. Senior-friendly upgrades to residences can cost from $10,000 to $100,000, and visiting care services can be about $4,000 a month. The toll that aging takes on the body may also necessitate changes to your home's design or layout. Basic home modifications, including installing grab bars, sturdy handrails along stairs, replacement rugs, better lighting, and lever-handled doorknobs, can cost up to $10,000. Meanwhile, more expensive renovations, such as removing or reducing the height of steps, widening hallways, adding a ramp, lowering cabinets, installing no-step showers, and installing a generator to protect against power loss, can cost up to $100,000. The average monthly cost of assisted living is $3,750. A private room in a nursing home can be around $8,121. A nursing home can cost $85,776 to $97,452 a year. There are benefits to nursing homes and assisted livings. In assisted livings and nursing homes, the buildings are designed to be feasible to the elderly. Also, all maintenance and repairs are handled by a professional, and the people living there get served 3 meals a day. Assisted livings can be a way for people that would be isolated at home to not feel so isolated. Facilities have common areas and encourage socialization. They have regularly planned activities and outings for the residents. Many communities have volunteer organizations to help elderly people remain at home. For example, Good Neighbors of Park Slope in Brooklyn and Staying in Place in Woodstock, New York, help make people's lives easier. Communities that have supermarkets, banks, hardware stores, worship facilities, and recreational facilities in walking distance are a good place for elderly people to live. Also, places that have low-cost, efficient public transportation allow elderly people to get anywhere they need to go. Communities have tried to accommodate the growing number of elderly people in the country as baby boomers age by making different changes. Changes such as altering traffic signals and street crossing to give people more time to cross makes it safer for older people who may walk slower. New York City has created aging independent districts to help older people live as independently and engaged in the city as possible. For example, in East Harlem, stores have made signs easier to read, and they put out folding chairs for seniors to rest before and after shopping if wanted. In Philadelphia, a nonprofit organization called Friends in the City brings its members closer to the city's resources and to one another. The organization calls itself a community without walls. Friends in the City offers seniors a variety of programs every day that accommodates many different cultural and recreational interests. Home sharing has been an evolving concept. Home sharing is when several older people who may not necessarily know each other buy a home together to live and share responsibilities such as cooking, shopping, cleaning, and home repair. For example, Let's Share Housing in Oregon and Home Share Now in Vermont have online services that connect people with similar needs. Some older people move in with their children's family. They may live in an attached apartment or a separate floor. Not only does this help an older person live comfortably without having to go to a nursing home, it can give grandchildren a chance to form a more intimate relationship with their grandparent. Gerotechnology is becoming popular as a way for elderly people to live safely at home. Some examples of gerotechnology are activity monitoring devices, which allow caretakers to track an older person's activity, advanced communication interfaces, and telemedicine. There can be barriers to who uses gerotechnology. For example, older people with higher education and income and those who have a partner are more likely to use technologies than older people that live alone and have a lower socioeconomic background. The benefits of gerotechnology are it can reduce caregiver burden, extend healthy aging in place, and minimize demands on the healthcare system. 4 major themes have emerged as important for older adults to age in place with the help of gerotechnology. 1. Safety and independence. 2. Social interaction. 3. Use of technology in the past. And 4. Desire for support. The pros of telemedicine are a quick information turnaround, reduced travel time and expense for both the care recipient and caregiver, and feeling more secure when living alone. The cons of telemedicine are it could be expensive. So after doing my research, I found that there are pros and cons to both aging in place and living in a nursing home. It is really up to the elderly person's personal preferences, medical conditions, money, and access to caregivers. And these are the sources I use. Thank you.